We thought the coronavirus vaccine agenda couldn't get any worse. We now have information directly coming from the US Department of Defense, also known, of course, as the DoD, giving more information about the type of vaccines that they're working on and the type of organizations that are developing these vaccines that they are partnering with in order to mobilize the military to deliver these vaccines door to door, as Donald Trump, of course, recently said. Hey everybody, this is Julian Price. Welcome back to another video, and I'm here to present you some terrible information. And when I say terrible information, I mean information that will probably make your stomach crawl. So of course, if you don't know about Operation Warp Speed is a United States intelligence operation that is being led, admittedly, by Donald Trump, which is our current president, to deliver and create as fast and as soon as possible a coronavirus vaccine for the new COVID-19 disease that allegedly exists. And not only that, however, but in a recent interview with Fox News, Trump gives more detail as to how this operation will play out and who exactly are the players that are going to be involved in the distribution of these types of vaccines that the president is working on. And of course, in that interview, which unfortunately I don't have it with me now, but I will probably link it in the description below by the end of this video so that you guys can see it for yourself. Donald Trump, of course, saying that the military are going to be mobilized to deliver these vaccinations. So of course, we're talking about a massive military vaccination type of operation and roundup that is probably going to be deployed in this year or the end of this year, 2020. Of course, a lot of people have speculated if this means that these vaccinations are going to be mandatory. And of course, there's not a lot of testing that has been done on the type of coronavirus vaccines that they're trying to install. Of course, given the name Warp Speed, obviously it would imply that this operation is going to go very fast and that what they're trying to develop will be in a fast manner. But now we have new detail coming from this article coming out from the Department of Defense that was just released a few days ago, about 3 days ago, on May 12, 2020, and today is May 15, 2020, so it wasn't that long ago. The Department of Defense recently came out talking about the partnership that they have with a special organization. So without further ado, let's read the article. So it says in the release here, quote, a statement attributed by Lieutenant Colonel Mike Andrews, the Department of Defense spokesman, says, quote, today, the Department of Defense and the U.S. Department of Health and Human Services announced a $138 million contract with ApiJect Systems America for Project Jumpstart and Rapid USA, which together will dramatically expand U.S. production capability and domestically manufactured medical-grade injection devices starting by the year 2020 in October. In October 2020, they will distribute and work on a creation, as it says right here, with an organization called ApiJect and Jumpstart Rapid USA, which together will dramatically expand U.S. production capability for domestically manufactured medical-grade injection devices. Injection devices. Well, devices sounds pretty technological if you ask me, and injection is obviously something that is injected in you starting by the year October 2020. Superheaded by the DoD's Joint Execution Task Force GATF in coordination with the HHSF Office of the Assistant Secretary for Preparedness and Response, the contract will support Jumpstart to create a U.S.-based high-speed supply chain for pre-filled syringes, vaccinations, being later this year by using well-established blow-fill seal accepted plastic manufacturing technology suitable for combating COVID-19. So they're telling you that all of this stuff is being manufactured for COVID-19, just in case it wasn't clear enough for you. They're telling you that this stuff is being worked on for COVID-19. When a safe and proven vaccine becomes available, this will become, of course, this will be involved with the vaccines. right? So they also go on to say here, the contract also enables ApiJect Systems America to accelerate the launch of a rapid USA manufactured vaccination campaign. Now, the article in and of itself is pretty short, and it really just talks about the fact that the U.S. Department of Defense, the Pentagon, the military-industrial complex, is working with an organization called ApiJect to develop these vaccines, right? And these medical grade injection devices. Pretty weird language, if you ask me. They're injection devices that will be starting in October 2020. Now, of course, you might think for yourself, what exactly are they talking about it? In this case, what are these injection devices? Well, unfortunately, when we actually go to the ApiJect website itself, which I'm about to show you, it tells you more detail about these vaccinations that they're working on. So this is apiject.com, and it says right here the title, Introducing the BFS Prefilled Syringe. It's time to improve how we inject medicines and vaccines, ultra low cost, single-use safety, and rapid scalability. So this is the organization that the Department of Defense is working with. Obviously, this all has to do with Operation Warp Speed, as it clearly says in the other article from the DoD. If you don't know what Operation Warp Speed is, I'm not going to explain it in this video. I highly recommend you to look it up for yourself because it will be clear to you what it is. It's basically, like I said, an operation that merges the military-industrial complex with pharmaceutical companies, vaccine manufacturers, and other leading pharmaceuticals to create a vaccine for the COVID-19. So it's basically an operation that merges the military industrial complex, aka the government, with pharmaceutical companies to develop these vaccines. That's a part of Operation Warp Speed. And one of the organizations that the DoD is working with to develop these vaccines is ApiJect.com. So we're going to see here what exactly are the type of vaccines that they're working on here. So obviously you could see these are the plastic vaccines that they say that, the BFS that are going to be obviously connected with this, these doses of vaccines that Donald Trump wants to create. He wants to create 500 million doses of vaccines, which is obviously a little bit more than what would be expected, considering that there are only about 320 or so million people in the United States. Why would you need 500 million? I'm not so sure, but that's what they're working on. Now, if you scroll down to the article here from their own website, you can see something very interesting, a digital snapshot for every injection. So let's take a read. Whether health officials are running a scheduled vaccination program or an urgent pandemic response campaign, they can make better decisions if they know when and where each injection occurs. With an optional RFID tag on each BFS pre-filled syringe, which is the vaccines, right? The plastic ones that they're working on. ApiJect will make this possible. Before giving an injection, the healthcare worker will be able to launch a free mobile app and tap the pre-filled syringe on their phone, capturing the NFC tag's unique serial number, GPS location, date, and time. The app then uploads the data to a government-selected cloud database. Arranging the injection data provides health administrators an evolving real-time injection map. So basically, they're going to track down each and every injection that people get. They say that it's optional, but I mean, come on, guys. You really think that people are going to want to be tracked this way? I mean, come on, seriously? I highly doubt that that's the case, or at least I hope that's not the case, or that is the case, because if it is true that people are just going to, blindly accept this, then folks, there's no hope for the majority of humanity there. They're just completely asleep and they don't know what's going on. And that's why we need to wake them up. So just look at the language of this article. It says a digital snapshot for every injection. Obviously, it's talking about this vaccine here that you see right in front of your screen. So it's basically saying that with every injection of a vaccine, you could have it where there is an RFID microchip or an RFID tag, okay, on each BFS prefilled syringe, which means this is the BFS, by the way. Okay, this is what it is. You're seeing it right now. So they're not necessarily saying that they're going to inject a microchip inside your body, although I will show you evidence that might show that that is the case in a bit here. But they are saying that this thing that they're working on with the vaccines is going to come with an RFID tag, right? Kind of like an RFID microchip that used to be talked about in the past. This tag will be on each, so it's going to be on the vaccines, folks. It's going to be on the vaccines, and it's going to be a tag that you're then going to have to scan with a certain app that whoever is giving you the vaccine is going to make you download on your phone, or they might already have it on their phone, that they're going to basically scan the tag that's on the vaccine, all right, to document your information data and when it is that you took this injection. So they're tracking people who took the vaccines, or tracking people with a digital snapshot to make sure that these types of things are being recorded. So you might say, okay, well, this is not a microchip. Why are you mentioning this? This is just a new technological way that they're going to be able to track people who have taken these vaccines and mark your location and your data history and all that stuff that comes along with a RFID tag on the vaccine. Why is this important? And how does this tie into Trump? Well, if you think that Trump has nothing to do with this operation, because a lot of people are talking about Bill Gates, a lot of people are talking about Anthony Fauci, but not a lot of people are talking about Trump. I already said that Trump has come out and said that he is the head of this operation, but if you want further proof that the type of people that Trump is knowingly and willingly appointing within his cabinet with his coronavirus task force to implement these operations in the first place, let me show you another story right here. This one is from a website called The Last American Vagabond. I highly recommend that you guys take a look at this website. This website is a very good site that really gives you the information in and of itself, so that there's no denying that this stuff is going on. Obviously, they have very, very great articles here about all kinds of stuff. Bill Gates, this whole vaccine development agenda and things of this nature. So they recently wrote an article here, right here. Trump appoints Big Pharma, executive connected to Bill Gates to head vaccine development. So Trump, if you believe that he has nothing to do with Bill Gates and that they're actually enemies, think again, because they both have the same agenda here, unfortunately. So we're going to read you this article here. On Friday, Donald Trump announced his appointment. His name is Moncef Saouli, a former executive with vaccine manufacturer GlaxoSmithKline, which is a vaccine company, to lead Operation Warp Speed. So this is the man, Moncef Slaio, who Trump appointed to lead Operation Warp Speed. Let's keep reading. Trump's plan to fast-track the development of vaccines for COVID-19. Saouli will serve in a volunteer position assigned by the Army General Gustavo Perna, the commander of the United States Army Marshall Command. Let's just read a little bit. I know you guys want to see the connection with Bill Gates. It says right here, according to the Trump administration, Operation Warp Speed program is focusing on 4 vaccines with the hopes of testing and producing, get this guys, 100 million doses by October 2020. So they're working on this stuff fast. 200 million by December and 300 million doses by January of 2021. At Friday's press conference, Saouli said he believes the goal of vaccines by January 2021 is a credible goal. Secretary of Defense Mark Esper was more critical, stating that winning matters and we will deliver a vaccine by the end of this year. Operation Warp Speed and the calls for public-private partnerships mimic National Institutes for Health recent calls for bringing together pharmaceutical companies to develop a vaccine for COVID-19. The NIH plan, emphasizes a collaborative framework of prioritizing vaccines and drug candidates simulating clinical trials. So they're going to ignore that basically. Coordinating regulatory process and or leveraging assets among all partners to rapidly respond to the COVID-19 and future pandemics. Now, here's his connection with the Bill and Melinda Gates Foundation. It says right here, an examination of the career and connections of Dr. Moncef Saouli reveals that Donald Trump's appointment of a big pharma executive is not a cause for celebration, but rather another piece of the connection with the Bill and Melinda Gates medical mafia. So it says right here, just a little brief biography of him, but it also says right here that in 2016, Moncef Saouli was appointed to the board of directors for Modern Therapeutics, a biotech company that is leading the way for a messenger RNA, mRNA therapeutics and vaccines. TLIV writer Whitney Webb recently reported on the site saying that the Coalition for Epidemic Preparedness Innovations, or the CEPI, announced that it would fund 3 separate programs in order to promote the development of a vaccine for the new coronavirus responsible for the current outbreak. The CEPI, which describes itself as a partnership of public, private, philanthropic, and civil organizations that will finance and coordinate the development of vaccines against high-priority public health threats. And this organization was founded in 2017 by the governments of Norway and India, along with the World Economic Forum and the Bill and Melinda Gates Foundation. So yes, this guy here that has been a representative of this organization is directly funded, of course, not surprisingly, by the Bill and Melinda Gates Foundation. So obviously, folks, this is something that is directly connected with our enemies. Now, just to read you more information about the type of vaccines that they're working on, which does sound more like a microchip being injected into you. I read somewhere in this article right here that the team is working on a type of vaccination that will have some sort of device injected in you, which will go through your nervous system. So let's see if I could find that anywhere here. It talks about Bill Gates, right? Maybe right here. Okay, here we go. More recently, Saouli sits boards of pharmaceutical companies and biotechnology organizations. He is also partner at the Medic IX investment firm, chairman of the board of Glavani Bioelectronics, of course, which is also funded by Bill Gates, chairman of the board of Sutrax Vax, and sits on the board of RT Says Biosciences. Human Sciences Project and Moderna Therapeutics, each of these companies is involved in vaccine development and the emerging fields of bioelectronics. Galvini Bioelectronics was formed out of an agreement with the Life Sciences LLC, an alphabet company, and GSK. The goal is to enable the research of development and the commercialization of bioelectronic medicines. Now here's where it gets interesting. The bioelectronic medicine, remember, bioelectronics, so it's biology, electronic. Medicine is a relatively new research field focused on tackling chronic diseases by using miniaturized implantable devices that can modify electrical signals that pass along nerves in the body, including irregular or altered impulses that occur in many illnesses. So the operation that they've been working on for many years, right, which is directly tied with this man here who was the head of it at one point in time and is considering this type of research for the Operation Warp Speed headed by Trump, and now this guy, which is his appointee, says in the journal, that they are working on using this organization. Bioelectronic medicine is a relatively new research field focused on tackling chronic diseases by using miniaturized implantable devices very similar to a microchip that can modify electronic signals that pass along nerves in the body. So this is what they're telling you that they're working on. These organizations that are connected with this man, and this man was leading this type of research even way before Operation Warp Speed. Okay, and who knows, obviously, what I read to you with Operation Warp Speed, they're connected with ApiJect, which is obviously, involved with all of this stuff to head this campaign. But it gets even worse, guys, because many people are wondering, is this stuff going to be mandatory? I'm going to read you another article that shows that it might actually be mandatory in some states in the United States. So let's keep reading here. GSK has been active in the field since 2012 and has stated that chronic conditions such as anthrax, diabetes, and others could potentially be treated using these devices. So these are devices, they're telling you in the journal that they're going to be, this is a direct quote from the journal, folks. This is not coming from this website. The reason why it's highlighted is because this is something that they're saying. This is not from this site. And you could, obviously I'm going to link this in the description below so that you guys can read it yourself. So they're telling you that they're working on devices that are going to be implemented in your body. Okay? That's the context of this, right? With these devices, obviously the word device is technological in nature. Continuing, GSK called a partnership an important step in the research of bioelectronics. GSK stated that if they were successful at using advances in biology and technology to correct the irregular patterns found in disease states using miniaturized devices attached to individual nerves, this method would be a new paratherapeutic modality alongside traditional medicines and vaccines. And of course, if you can see your screen here, these are direct quotes from the website. And just to make sure, you can just click on the link there. It sends you to the actual website, gsk.com, where they're talking about all these things, such as the implantable devices and things like that. I will also leave this article from their own website in the description below. Technological expertise and all that stuff, the medical devices that will be injected in people that they have been working on for so long now. So, obviously, this type of stuff is in the works. I'm not going to read this entire article, but it's a really good article that I highly recommend you guys to read because it's something that they have been in the works on for many years, and it was previously headed by this man right here, who is now an appointee that Trump has chosen for leading Operation Warp Speed. Now, the big question also is, will this stuff be mandatory? Will a vaccine like this, which Trump has already come out and said that they're mobilizing the military, you have to ask yourself, why are they mobilizing the military? This isn't the National Guard, folks. This is the military, okay? This is the DOD. The Department of Defense does not include police officers, and it doesn't even include the National Guard. It includes, like, the U.S. Army, okay? And the Coast Guards and things like that. All of these are part of the DOD, not police officers. We're not talking about police officers. We're talking about the military being mobilized to distribute these vaccines. So obviously the military is probably going to use some sort of force. We don't know that for sure, but that's what a lot of people are concerned about. Obviously, time will, when the time comes eventually, we'll see if any of this stuff is actually true, if the military is going to be using some sort of technology like that. So it says right here, the U.S. state has already established legal means for mandatory vaccinations, right? And let me just say this, folks. You may think, and I'm talking about the skeptics, I'm not talking about the people who know, but you may think that this, all this stuff with GSK and all that stuff, and the implantable, devices within people's bodies that will be, that they're working on, these medical devices that they're going to be able to implement within the body to attract the nervous systems and all that stuff in the human body. You may think that has nothing to do with Operation Warp Speed, and it does, because this research was being headed by the man who is now in charge of the operation. And I'm pretty sure that if they were working on this years ago, they're still going to work on it today for this new vaccine of the coronavirus. This is, of course, speculative. We don't really know if a vaccine like this is going to come out the way that they say it is, but we do know, and we could have a clue based on the, ApiJect company that the Pentagon is working with, that they are going to include devices and things of this nature. So, will all of this stuff be mandatory? This is the last article I'm going to read. So let me read to you another great article from their website. It says, while the U.S. government and global health authorities debate how quickly they can roll out contact tracing programs and fast-track devices, Americans are left wondering and debating over whether the vaccination programs for COVID-19 might end up being mandatory. It is true what Donald Trump has acknowledged, that we are looking for a full vaccine for everyone who wants to get it. Not everyone wants to get it. So, of course, this is something that Trump said. Not everybody wants to get the vaccine. Obviously, I don't want to get the vaccine either. However, it's still uncertain whether the Trump administration will side with civil liberties and informed consent when it comes to COVID-19 vaccine. What is certain, however, at this point is that at least one state in the United States of America has already implemented measures which will allow for forced or mandatory vaccinations once a COVID-19 vaccine is developed. So what is the evidence of all this, of course? Well, here's the evidence. The Last American Vagabond was recently sent the meme below, which has been circulating the internet in recent days. The image claims that someone's husband recently flew from Louisiana to Florida, where he was handed a mandatory quarantine form to fill out. According to the post, the man was especially forced to sign if he wanted to exit the plane. The image then shows a screenshot of a document which states that individuals who violate the quarantine will be subjected to either $500 of each fine or 60-day jail sentence. Furthermore, the meme states that, quote, the state health officer and surgeon general can order any individual to be examined, tested, vaccinated, treated, isolated, or quarantined for COVID-19. And here's, of course, the image of this document. So, of course, American Vagabond said that we decided to fact check this meme to see if there was truth to the claim, and unfortunately, the document is in fact a Florida state document. Here's what we found. The document, which they link right here, I'm not going to show you because I don't know if it's going to, take me to some sort of PDF, and I don't want to do that right now. I want to show you this stuff first, guys. So it says right here, the document, which is called COVID-19 Department of Health Mandatory Self-Isolation Airport Travel, can be found on the official website of the Florida Airports Council. So again, there you have another link. And here's an image too. The form asks travelers to put their home address, a detailed description of the trip, and the names and birth dates to family members who traveled with the person filling out the form. So it says right here, I understand any individual in my family who violates the self-isolation or quarantine by falling or remain within the context of the address that I provided for my stay in Florida. And get this, guys, it says right here, failure to follow any isolation or quarantine order by the Florida Department of Health is second-degree misdemeanor. Wow. Right there in plain language, a Florida state document which is being handed out to individuals flying into Florida claims the Surgeon General can order any individual to be vaccinated. So let's read. I didn't read that. Oh, here it is. I'm sorry, guys. The actual real paragraph that I want to show you guys is this. It says that the pursuit to Executive Order 20-80 and the Florida Department of Health Declaration for a Public Health Emergency, the state health officer and surgeon general can order any individual to be examined, tested, vaccinated, treated, isolated, or quarantined for COVID-19. So basically what they're saying, folks, is that they claim that they have a legal right under the health surgeon, okay, the state health officer and surgeon general, to force people to get tested, examined, treated, and yes, the word vaccinated is indeed in the article. And it's even right here outlined underneath the paragraph of this document, which you could download yourself. And of course, I'm not going to click the link, but I will leave this in the description below if you want to check it out yourself. And then the article goes on to talk about all kinds of other things, and then that's when it shortly ends. So it seems that clearly there are making plans in certain states like Florida under the health general surgeon to make it mandatory, according to their files and documents. They're coming out saying that yes, we have a legal right to test you for COVID-19. We have a legal right to get you vaccinated for COVID-19. And it seems like this might be mandatory, folks. But don't worry. I'm pretty sure there are a lot of people that are, at least I hope, that are not going to want to take this vaccine and are going to fight. I know I am. So I'll leave you this great article if you want to read it for yourself in the description below. Thank you guys for watching. Please hit that subscribe button if you're new. And I will see you all in the next video. Thank you very much and God bless. And remember, folks, remember, you need to pray to God more than anything. Okay? You need to pray to God to give you strength. You need to pray to God to give you emotional courage and emotional strength and spiritual strength, and of course physical strength. Obviously, I would recommend you guys to train yourself to exercise every day. If you have no experience firing weapons, firearms, things of this nature, I highly recommend that you start getting used to that, because you don't know how far this stuff is going to go. They already said that they're going to use, in the state of Florida, according to their own documents, that they are going to make it mandatory in their own language that if they want to test you, if they want to vaccinate you, they will do so. And if you resist, you will either be fined $500 or you will go to prison for an X amount of days. Obviously, guys, you need to really train, because I don't know where this stuff is going to go. This stuff is really dangerous. You need to pray that God gives us strength and leads all the nations of the world against the globalists who control our reality and the globalists who control our world. We need to pray to God to give us strength against the globalists, who are the most powerful people on the planet or on the earth, whatever it is you believe we're on. And that's all I have to say, folks. Thank you for watching. God bless.